Hello, I'm Samantha Simmons. Welcome to Allergy and Clinical Immunology, Attention Needed, a programme from the British Society for Allergy and Clinical Immunology and ITN Productions. In our reports, we'll be looking at allergies, anaphylaxis and awareness to prevent the worst possible outcomes. And often mistaken for allergies, we'll be finding out about the diseases that can go undiagnosed for years. Well, joining me now to tell us more about BSACI's commitment to raising awareness of allergies and clinical immunology is their president, Professor Adam Fox. Professor, welcome to you. Thanks very much for being with us. Now, this year, of course, has been defined by this pandemic, especially concerning for those with compromised respiratory function or immune systems.
Yeah, the pandemic has raised so many issues within the allergy communities for our patients and also for specialists as well. Of course, at the beginning, there was understandably real concern that people with allergies may be at increased risk of suffering more severe effects of getting COVID. Thankfully, that hasn't really been borne out. But many of our patients, especially with severe allergic problems, will be on medications that will suppress their immune systems. And as a result, they've had to shield and be much more careful because of that increased risk. Alongside that, a whole load of other issues have come up. So, for example, when the supermarket shelves were pretty bare at the end of March and early April, that was a real problem for people with food allergies who are reliant on very specific foods because of the different things that they can't eat. Likewise, as people were starting to send their kids back to school, those who are at risk of anaphylaxis, the parents were really worried that social distancing rules for staff would mean that they wouldn't be attending to their kids if they had reactions as quickly as possible. So we tried to work very closely with allergy charities to get consistent, accurate information out there to reassure patients. We've lobbied government agencies. For example, the Department of Education, as a result of our lobbying, changed their advice around social distancing for medical emergencies relating to anaphylaxis, which has been really reassuring to patients.
Professor, even without COVID-19, there's often a lot of confusion and misinformation surrounding allergies. Why is that?
There is a lot of misinformation, and that's not just patients, that's amongst healthcare professionals, frustratingly as well. And I think one of the reasons, particularly in the UK, is this information gap that's resulted because of a large mismatch between the burden of disease, the huge number of people who suffer from allergies, and a very small specialist provision. So very few allergy clinics that are able to support those. And as a result, patients will go to the internet, and online there's so much unreliable and really unhelpful information.
So where do you think people should be going to source the correct information?
I think a good place to start would be the websites of the allergy charities, Allergy UK, the Anaphylaxis campaign. And on the British Society of Allergy and Clinical Immunology website, we also have a clinic guide that will guide you to where your local allergy clinic is.
And why do you think it is that the number of children with allergies is on the rise in the UK?
I don't think we really know exactly why that's happening, but there is data to suggest that there are increases in allergic diseases. Remarkably, something like 40 to 50% of kids will have one allergic diagnosis or the other, food allergy or asthma, eczema or hay fever. I think we're now moving past the hygiene hypothesis, this idea that because our kids are less exposed to infections, that they're more likely to develop allergies. And I think it's becoming clear from the research that this is much more about what we call the microbiome, so the bacteria that colonize our gut. There's been a whole range of changes in our lifestyles in the last 20 to 30 years that have impacted on which bacteria colonize our gut from very early on. And that seems to be then influencing the way that our immune system interacts with the outside world. And one of those changes seems to be more likelihood of allergies.
And are the number of allergies leading to anaphylaxis also on the rise?
Well, there's clear evidence from all over the world, from Australia, the US, from Europe, and certainly from the NHS, that we're seeing more severe allergic reactions showing up in emergency departments. If you dig into that, it seems that the increase is younger children having more severe allergic reactions to food. And it certainly seems that the increase in the amount of food allergy in that population is driving the increase. We certainly want to see more investment in NHS allergy services so that patients with allergy have got a better chance of accessing the specialist care that they'll benefit from. But I think there's a whole range of other things as well. So, for example, having a fatal anaphylaxis registry funded ideally by the Food Standards Agency will allow us to learn lessons when tragic events occur. We want to see the Department of Education stepping up to provide national guidance in collaboration with ourselves and allergy charities, so that allergy is managed much better in schools, because that seems to be a real issue for many patients who have food allergies and don't get the care that they need when they're in school. We'd also like to see better food labelling. We've had a real advance with Natasha's law, but more's needed. We want restaurants to be displaying full ingredients on menus. We'd like to see better provision of adrenaline auto-injectors in places where reactions are more likely, building on the positive changes from the spare pens in schools that allow schools to stock additional adrenaline injectors that can be used on any child. And of course, we'd like to see more research funding, because we'd like to find ourselves in a position that we don't need the other measures, because we've got to the point that we're able to treat allergies so that patients aren't at risk.
Well, we will be looking further at anaphylaxis and the outcome it can have further in our special report. But for now, Professor Adam Fox, thank you.
Thank you.